Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Recently, all in the press, I don't know, it's like every day you almost see something about the prostate gland of men, of course. People, I wrote an article not too long ago, the difference between, people don't say the term sometimes, it's prostate, not prostrate. You know, prostrate is when you fall out and pray, and prostate is the prostate gland itself. And of course, people get the term mixed up sometimes because in my church, I go to when they sing the song, "All Hail the Power of Jesus' Name, let angels prostate fall." Prostrate is prostrate. Angels don't have a prostate gland, you know. But so, get the idea that it's the prostate that we can talk about, and where this gland is located, and why it's so important today, and why you're hearing so much about it. I personally, coming along, I never heard, not as a physician, but I'm just talking about as a general person. No one ever speak about the prostate gland. In all of my years, my father, nobody spoke about it in my family or in general uncles and things like this. So I don't know exactly when it became important, and this is what we're going to get into with Dr. McNeil today, Brian Keith McNeil, who's our urologist here at Downstate Medical Center. So I want to welcome you, Dr. McNeil.
Good to be here, Dr. Deas.
Yeah, nice having you. Prostate, now prostate. You said, I know in our conversation before you mentioned the fact that your father had some problem with the prostate gland, and that influenced you almost in the sense of becoming a urologist, where this is taken care of.
Yeah, it actually did. My father, actually, I love my dad to death. I thought he was a stand-up guy. He was a carpenter, and he would take me to work with him most days during the summer.
I see.
And he'd say, "Hey, I hope your brain is good because your hands aren't going to get you anywhere."
Well, that's
yeah.
I know, sure.
Yeah, but my dad, he was a great guy. I cared about him, but he wasn't the most aggressive in pursuing health care.
I see.
I think, he felt like he was doing great, and he just never went to the doctor.
Right.
And when I was approaching my senior year of high school, he started having back pain and trouble urinating. He went to the doctor, saw a urologist, and lo and behold, he was diagnosed with prostate cancer.
How old was he at that time?
At that time, my father was 63.
And it wasn't running in the family? No one else did you?
No, I wasn't aware of anyone else in the family with it. But I tell you something, he was diagnosed with prostate cancer, and he was dead within a year because they had caught it at a very late stage where it had already spread to his bones. Prostate cancer can actually spread outside of the prostate and spread to the bones if it's not caught at an early enough stage.
Right, yes.
And, there wasn't much that could be done for him.
Right.
And that's why it's extremely important for men of all ages actually, to follow up with their physicians. And I think it's important for men, especially, Black men, African American men, Caribbean American men,
right.
West Indian men, however you,
right.
Think of yourself. I think, and also men from other backgrounds as well, I think it's extremely important to have your prostate gland examined.
Right. What do you think the high incidence in African Americans, or like you said, the Caribbean and folks of skin color, in Africa, does prostate cancer, is that a problem in Africa?
It occurs, it happens, but I'm not sure if anyone knows the true incidence of it.
Yes.
Because oftentimes, depending on the location, sometimes men die and people don't know why.
That's right.
Everyone doesn't get an autopsy.
That's right, surely.
But in some of the studies that have been done, African American men, and especially Caribbean American men from the West Indies, have the highest incidence and the highest rate of death from prostate cancer.
Right.
If you look at people from various ethnic backgrounds, it affects, those men the most, actually.
I think sometimes when you think of the mixed genetics that African American men have had with the Caucasian population as such, the DNA as such, I sometimes wonder, has that played a role in our incidence of prostate cancer? Not that white men have it any more than black men, but certainly it's almost a contagious disease, almost, I would say, in black men.
Yeah. Well, I wouldn't think of it as contagious necessarily, because it's not something that someone catches. You know, we know a good deal about prostate cancer, but there are some things that we don't know. For instance, there are some prostate cancers that are very aggressive. They're prone to spread and cause problems.
Right.
Whereas there are other prostate cancers which remain relatively stable that we can watch.
Right, yes.
And right now, we're actually doing research to look at genetic clues to differentiate one from the other.
All right. That's so important, because I think that when I look at prostate cancer, I didn't have a lot of patients with prostate cancer as such, but and the PSA. Maybe you get on to the PSA. How do you detect early prostate cancer?
There are a number of ways to detect early prostate
Okay.
cancer. PSA is the thing that most people think about. There have been a number of articles, both in the scientific journals and in mainstream journals,
Right.
about PSA and PSA screening.
Right.
PSA is actually a small protein. Think of it like a protein that's released from the prostate.
Mm-hmm.
And, you know, most men's prostate produce PSA.
Right.
However, some people produce too much PSA, and that can be picked up in the bloodstream.
Okay.
Now, because your PSA is high, that doesn't mean that you have cancer. There are a number of things that can cause an elevated PSA.
Right.
For instance, if someone has a larger prostate might produce more PSA.
I see.
You know, if someone
Yeah.
has like inflammation or an infection of their prostate, something
Right.
that we call prostatitis,
Right.
that can cause an increase in your PSA as well.
Surely. Surely.
You know, historically, most people have thought of an abnormal PSA as being a PSA level above 4. But nowadays, I've diagnosed men with prostate cancer who have PSAs as low as 2 or even 1.5. So it's
see.
not the absolute level. I actually take into account your age as well.
I see. Is it a slow-growing cancer, or sometimes it's very aggressive, in others it's very slow-growing, like you say?
Right, right. The course of prostate cancer is very variable. If you were to probably take out all men's prostates or look at them at the age of 80, a lot of guys would have prostate cancer and it wouldn't bother them a bit.
Right.
You know, it's variable. Again, you know, there are some prostate cancers that are extremely aggressive and prone to spread, whereas there are others, you know, where the prostate cancer just remains sort of stable and doesn't do much.
Well, that's interesting, because what's your take on treating prostate cancer, therefore, at different age levels? Would you treat somebody who had a high PSA at the age of 80 as aggressively as you would if they were 40?
It sort of depends on, you know, what the PSA was, what their prostate felt like, and also what their, you know, quality of life is like.
Right,
because
okay.
every 80-year-old gentleman isn't the same.
Right, surely.
There are some that'll run us both around the track,
That's
and there are
right,
others
surely.
who, you know, aren't that active. So I
Right.
think it depends on the person's activity level, whether or not they're having problems urinating. And one thing about prostate cancer, a man could have prostate cancer and live 10, 20 years, and they may die because of something else.
Right, surely. Tell me this, when I mentioned something contagious before, as an organism, is there any organism that's being looked at that could possibly cause prostate cancer? When I say that, viral, parasitic, anything like this, because basically with the male, again, as I say, as he sits on a commode and so forth, and his penis is in the toilet itself, like with surroundings, and they flush and things like this. I'm just taken by how long it took us to find the cause of a stomach ulcer, for example, Helicobacter pylori. It took us operations, treatments, and things, and all of a sudden now we can cure a stomach ulcer.
Right, isn't it
in
something?
2 weeks,
Yeah.
you know, with no surgery and anything like this. You know, so I'm just worried. I'm just thinking, will it come to be a viral thing, or possibly a bacterial thing, or something that will set that DNA trigger off to start the cells dividing? Has there been anything along those lines that you're familiar with?
Dr. Deas, honestly, I don't know. You know, there are a number of researchers all around the country, around the world, actually looking at that same question.
Right.
You know, is there an organism? Is there something in the diet? Is there, you know, something about your environment?
Yes.
You know, we believe that there are environmental factors which influence the rate of prostate cancer,
Right.
but we don't know exactly what they are.
Right, surely.
You know, some researchers may find one thing and another group of researchers may find something else that contradicts that. So
Right, yes.
we're doing our best to work together
Right,
to answer
right.
those questions.
Well, you know, I'm just concerned about it mainly because they were talking about, when you say diet, and we're talking about things like alcohol and beer. Beer has a lot of organisms in it and so forth. And in fact, they found something I recently had read where beer drinkers, it reduces the female hormone, production of the female hormone in the male, allowing the male hormone to take over more in just beer drinkers. And I was interested in doing a study on people with prostate cancer, what they're using as their regular beverages and things like this, whether it's an alcoholic beverage or not, but mostly alcoholic beverages and things like this, because is there any higher incidence that you know of, say, who are alcoholics have a higher incidence of prostate cancer?
No, not that I'm aware of.
Yeah, right.
But that's a very interesting question and something that we should look at.
Yeah, because the body is so, you know, working at a cellular level, it is so sensitive. I had a gentleman one time who was taking, as I said before, azogantrysin. He had a urinary tract infection. And he was an Italian man. And he said, hey, doc, he said to me, he said, you know that big red pill you gave me? I said, yeah. He said, it got stuck right here, pointing to his genital area. He thought the pill that I gave him went right down through his penis rather than dissolving all over the body.
Okay.
You know, when you think about it, you're taking aspirin. How much aspirin goes to the brain? When you think about it, aspirin is all over the body.
All over the body, yeah.
You know what I mean? And it takes molecules, just little molecules to affect the seriousness of a headache and so forth. But that aspirin is in your liver, it's all over your body. So it takes small amounts of things to start something. You know, and so when you think about how patients think about taking a medicine, if you're taking a heart medicine, you can swallow a pill, but if you put it under the tongue, it gets into the body much faster.
Right.
Without going through a whole system of being broken down and things like that, like vitamin B12, we do sublingual sometimes. Well, nitroglycerin, you put nitroglycerin under the tongue, it lights up the whole body. You know?
Yeah, we've actually been using that technology in urology as well. Of one main concern to men is erectile dysfunction.
Okay, that's
and
right.
the fact that, you know, at the age of 40 or 50, we don't function the way that we were when we were 18 per se.
Right.
As a matter of fact, most people don't realize that your erections change much earlier than thought. You know, even in your mid-30s or early 30s, sometimes things change.
Yeah.
And whereas most people think of pills for erection and Viagra, there is now a pill where, just like sublingual nitroglycerin, you just slip a little pill under your tongue and it works.
Well, you know, and even some of the plants, even before the different plants that they were taking. I remember before we even had Viagra and things like that. You know, people were going to the drugstore getting all kinds of potions.
Yeah. Ginseng and the yohimbe bark and stuff like that.
That's
Yeah, absolutely.
And what's really sad is that once you find something like Viagra, all the research seems to stop about other things that were working, basically, for erectile dysfunction. But maybe to understand, so our audience will understand what that dysfunction really means, maybe you could give a verbal description of what dysfunction is, as far as blood flow and things like that.
Right. So erectile dysfunction, it encompasses like a family of disorders. It's not just whether or not you can get hard as a man. Sometimes it's about how long you can sustain an erection. Whether or not you can sustain an erection to the point where you ejaculate or not. And also the stiffness of it. Because how stiff we are during sex, of course, that changes over time as well.
Right, sure.
So a man might get an erection that's sufficient for intercourse per se, but the quality of the intercourse won't be the same for both he and his partner.
Yes.
So there are different things we can do to help that as well.
Right. Such as?
Well, there are pills.
Okay.
There are different devices that we use, actually.
Maybe talk a minute about devices.
Oh, absolutely. So when I see a man who, is concerned about his erections, as you mentioned before, the key thing is a history. Does something happen all the time?
Right.
Is the erection enough for him to even have, intercourse? Is it a matter of it not being, as hard as he would like? Or is it a matter of sustaining an erection? Because there's a such thing as premature ejaculation.
Right, oh yeah.
And some people consider that to be, erectile dysfunction as well.
Surely.
So depending on the history and the actual problem, there are different exercises that we sometimes recommend. There are different behavioral things.
I see.
And in terms of devices, there are some men where we use a pump.
A pump,
Yeah,
actually a pump.
we refer, to it as a vacuum erection device, but it's a penile pump per se.
I see.
And what it does is it helps draw blood into the penis, and then you put on a little band at the base of the penis to constrict the blood flow out.
Right.
Now, and that's enough for some guys, and they're really happy with it.
Yeah, that's very interesting because folks when they talk about, in the street we talk as youngsters we were talking about the penis as a bone. It ain't no bone.
It's not a bone at all. But I tell you what makes us hard as men, there are two little channels, two little rods in the penis that fill with blood.
Right.
And actually what gives you, I guess, a boner, as some would say, are these channels filling with blood.
Surely.
And that's what gives the penis its stiffness.
Oh, yes. We're, prior to we are in sickle cell patients where the cells sickle and block the channels there from blood flowing into the penis or prevent the blood from coming out of the penis.
From coming out of the penis,
That is a serious thing among sickle cell patients.
Absolutely.
And of course, which causes immediate operation sometimes, and things like this. So, but it just shows a lot of times folks don't understand the dynamics of what's going on, and therefore they get either feeling a rejection or they can't perform and this thing, and they don't go further to a urologist. Again, the family physician can give you Viagra now and things like this, but there's many people that will not have the same effect with Viagra.
Yeah, Viagra isn't always the answer, and it also depends on your other medical problems too, because there are a lot of other medications that you take.
That's right.
For instance, if you have high blood pressure, that will impact your erections.
Of course, just the drugs that you're taking.
Yeah, just the drugs. But it's important to take your high blood pressure medications.
Right.
I'm not advocating that people don't take them.
Surely.
But
well, that's a real problem, though, of a person finding out that it is the blood pressure pills. Then it's up to the physician maybe to change that blood pressure pill that might not have the same effect.
Change it, or there are other things that we can do to enhance the erection.
Okay, surely, yes. And that's most important because I think we're not offered those kind of things in a regular clinic or even the regular general practitioner to say, look, I can get you to a urologist to maybe help you along the way here, because it can save a lot of marriages in a sense, because or save at least the importance of impotence, right? And I think that we miss that because we're embarrassed to talk about it. And the women, when they come to the office, they're embarrassed to tell their doctor that their husband is having a problem. In fact, I always say when a woman comes as a patient to me and starts talking about it, she's not getting the true picture of the whole thing herself, And so it's just important to give her as much advice as what's happening with their sexual relation.
Right.
So these kind of things are so important and so common that we as physicians, we have to think above the disease process about the social process that's going on with people between a married couple and things like this. Is there any particular advice that you offer patients, or are you into that? Is there any subspecialty among the urology that handle just that kind of thing?
There absolutely is. So there are, some urologists who focus on infertility and sexual function.
Right.
So for instance, if a couple is trying to conceive and have a child, and if there are, problems or issues, he or she, the urologist, would deal with that aspect. And they would also deal with potency and function. Now,
is there anything that you could give advice to a male right now with prostate problem, getting back to the prostate problem, there's many things that they're treating prostate cancer with, of course, and everyone will have a side effect. Is there anything that you use, any criteria that you use, or what patient you will put on a particular treatment?
Absolutely. So there are different ways to treat prostate cancer.
Okay.
You know, there's one aspect, and that's observation. We diagnose it and we watch it.
Okay.
There's another thing that's sort of come along in the past, 5 to 10 years, and it's called active surveillance.
Yes,
and we're doing that now because we've recognized as urologists that every man is not going to die of prostate cancer. So everyone who has prostate cancer doesn't need an operation.
Okay.
There are only some that do. So with active surveillance, we watch you closely, we see you. We may need to do a biopsy again in the future to determine whether or not things change. If things are the same and if your PSA level remains relatively stable, we can just watch you. That's why we call it active surveillance. So there's observation, there's active surveillance, there's hormone therapy. Prostate cancer actually feeds on the testosterone in your body. So for hormone therapy, you try to wipe out the testosterone to sort of starve the prostate cancer cells.
Okay.
The interesting thing about hormone therapy, though, is that there's some prostate cancer cells where even if they don't have access to testosterone, they'll still grow. But hormone therapy is only indicated in some men because the side effects are something else.
Oh, yes.
Then there's radiation therapy.
When you say side effects of the hormone, what would be mostly the side effects that a person taking the hormone therapy that they would experience?
Well, I don't think that hormone therapy is proper for any younger person because it can result in, impotence. It can change your mood. Some men develop gynecomastia, sort of the development of breasts. And also, one thing that a lot of people don't know about is that hormone therapy and wiping out the testosterone in your body, it, has an effect on your, your body fat percentage and also your bone density. So over time, your bones can sort of weaken.
Oh, yes.
With hormone therapy.
Right. And when you think of the neurological system, in so many ways, it's affecting the brain and things like this.
Absolutely.
People think it's just stopping below the head.
No, everything works in concert together.
Yeah, right, But getting back to the radiation now and things that you would suggest, who should get that, or when do you prescribe that type of thing? Or chemotherapy?
Right. So with prostate cancer, the way that we approach prostate cancer here at Downstate is it's individualized therapy.
Okay. Oh,
myself and my partners, we get a chance to know our patients to try to figure out what's the best for you. And we try to arm the patient with as much information as we can so they can, sort of decide what they like to do. The days of the doctor saying, this is what you need, do this, those days are gone.
That's right.
Doctors and patients are working together more. Patients are more invested in their care.
Oh, yeah.
So we will come up with a specific treatment plan for, the patient.
That is wonderful. Now, is that broken down racially, or do you find one race of men respond better than another race, for example?
Not necessarily. I base it on the person's age and their baseline function and just their overall health. While there's radiation, there's surgery too.
I see.
And luckily, we're fortunate enough here to be able to do the open surgery where we remove the prostate. And I also do robotic surgery where we use the robot to remove the prostate as well.
Is that more efficiently done during robot type of surgery? Because you hear it on television right now. These different places are offering these different things, saying we don't have to do any cutting anymore. We can go in with our robots and in 30 minutes have that thing taken care of.
Right. I've been extremely fortunate during the course of my training to be trained by experts in both. And open surgery isn't for everyone, and the robot isn't for everyone either.
Okay.
I think it's primarily your outcome of surgery. It's not about which technique you use.
Yes.
You automatically aren't guaranteed a better outcome with the robot versus an open surgery. It depends on your surgeon and how comfortable your surgeon is with either technique.
Very interesting. The thing is that it's coming right close to our end and it's gone so fast. But I like to think of diet. I like to think of things we're putting into our bodies, such as alcohol, smoking, and things like this. Is there any relationship between smoking and prostate cancer?
Smoking and prostate cancer, not sure, but there's definitely a correlation between smoking and bladder cancer. And anyone out there who has blood in their urine, come to see a urologist right away. Because smoking, it's been proven to have an impact on whether or not someone develops bladder cancer.
Yes.
And oftentimes the first sign of bladder cancer is blood in your urine.
Yes, you're right.
So if anyone has blood in their urine, they should see a urologist as soon as possible.
And I think it's very important, if they just see it once, don't count it as being insignificant.
No, it is
Sometime
significant.
You can have urination with blood in it, and then a few hours later have normal urine. Yes. So these are so, Dr. McNeil, it's so important that you're here today, but this is not going to be our last visit, because as things develop in prostate cancer and all the other things, and new things coming about, infectious diseases are maybe related to it, DNA related to it, all of these are going to develop. As being a young urologist, you'll be appraised to, so we want to bring you back to talk more about these kind of things. So it's nice
Looking
having
forward
you.
to it, Dr. Deas.
To you folks out there, just a little blood in the urine means a lot. Urinary frequency means a lot. Tell your doctor, before you even go to your doctor, write it down so you can ask them, does this mean anything, if you're having these kind of problems, because they can be corrected. Sometimes it can be corrected with just like exercises and things like this, or pills, but it can be taken care of. So just Dr. Deas, see you next time, and hopefully you'll take care of your urinary tract.